Hi, my name's Dr. Clinton Colaco and I'm an infectious diseases specialist. Today, I'd like to talk to you about one of my favorite topics in infectious diseases and infections, which is non-tuberculous mycobacteria, or NTM infections for short, and particularly those that involve the skin. Some patients experience chronic nodules, rash, difficulty in resolving some ulcers on the skin, and have had a number of treatments, including antibiotics, including simple biopsies and swabs that may or may not have yielded a positive result, or may have received a positive result, but rather still have a severe burden of disease. NTM infections can be acquired through the environment. This includes through swimming pools, contact with the ocean, contact with fish tanks, and a number of other places, including the environment. They're very difficult to diagnose, and a skin biopsy is generally required for those that exist external to the skin. However, sometimes this needs to be a very deep skin biopsy, which may need to be surgically performed. In other cases where this infection is deep to the skin surface and is presenting as an abscess, this may be found in the context of a surgical evacuation or swabs performed. It's also not uncommon for these sorts of infections to complicate cosmetic surgeries, particularly those that have been acquired or performed rather overseas, such as breast augmentation or tummy tucks or other cosmetic procedures. Treatment is quite varied, but essentially revolves around a combination of antibiotics either given orally completely or intravenously plus orally. Treatment can be as short as 3 months, but could be extended up to 18 months or longer if you are immunocompromised. These sorts of infections require very close guidance by an infectious diseases specialist. So when you are diagnosed with something like this, it's really important that you seek the help. These infections can also cause other organs to be affected, such as the lungs, the prostate, the brain, and other places. If you have an infection or you need some more advice or a second opinion, please do not hesitate to reach out to me today. Thank you.